so I'm Jaleesa with CNSA, and I'm here to demonstrate how to remove an NG tube. So I would have already checked the provider's orders, so I'm going to come in and identify the patient. Hello, Mr. Jones, how are you doing today? Can I see your armband?
Yes.
So I'm identifying the patient. Okay, so I'm here, I'm going to go ahead and remove your NG tube. Is that okay? Okay, so that's okay with him. So I'm gonna wash my hands, come over and apply for privacy. So I'm gonna provide privacy, come back to the patient, and his head's already lifted up, but if it wasn't, I'll be raising the head of the bed to a 45-degree angle. So now I'm just gonna raise the bed so it's comfortable for me. Okay, so wash my hands. Put on my gloves. Okay, so now I'm just looking and making sure everything looks good. Okay, so I have my clean gloves on. Now I'm gonna go ahead and just check placement. I have my syringe here. So you just want to remove the cap, put it in, and then you draw back slowly. Okay, so everything looks good. You're going to push it back in slowly. Okay, remove that. All right, so I'm going to instruct my patient to take deep breaths as I remove. So I'm going to unsecure. We're just going to pretend that there's the NG tube secure tape here. So I'm gonna remove the tape and I'm gonna have him take deep breaths as I pull out. So as you're pulling, you wanna make sure the tube is clamped and you're gonna pull out. Okay, take deep breaths, Mr. Jones. Keep taking deep breaths. Okay, and it is out. How you doing? Okay, so he's doing good. We're gonna check his breathing, make sure everything's fine. So at this moment, we're going to discard this in the appropriate bin, and we're going to provide mouth care. After the mouth care, you're done. Lower your bed back, and as always, just make sure your patient's comfortable.